Good morning. Welcome back, Mike.
Well, thank you. This is the last thing we need. What are you hearing about this, whatever you want to call it, strain, strand, variant?
Yeah. Well, all of those words are appropriate. I think you guys have done a great job of describing what we know and what we don't know. There's a lot we don't know. There are many scientists that are saying that this variant or mutant strain is more transmissible. That means it's more easily spread. But there are some scientists saying, hey, we don't quite know that for sure yet. All evidence, according to scientists, says that it's not necessarily more dangerous. At least we don't think so. They're not estimating that there's going to be a problem with vaccines or therapeutics. But honestly, the bottom line, guys, with this is we just don't know yet. That's really the bottom line.
It seems like they're really going after kids.
Well, you know, that's one of the things is there's still a lot of investigation to do. And you're right, it is in the UK. We're seeing it in other countries as well. And you guys were talking about a question about a travel ban. And Mike, I do agree with you that if we're going to do something, like if scientists determine that something needs to be done, it needs to be done soon. I would honestly say that, you know, it probably is here. Many scientists are saying that that strain is probably already here. And I would agree with that, too. Now, I do want to let our viewers know that viruses mutate. That is one of the things that they do. So I don't want people to be afraid and concerned because it's a variation or a variant or a mutation, because viruses just do that. The question is, what does this mutation or variation mean for us in terms of the vaccine, the treatments, et cetera?
And can you clear up for us, Dr. Jen, the difference? Because is it interchangeable, variant, mutation, strain? Because I've been hearing that. I just want to know, are they all the same level, or what does that mean?
Well, that's a really, really great question. You know, what we're really, the short answer is yes, Alex. They're really kind of all the same things. Really what we're talking about is a mutation in sort of the genetic code of the virus. It changes itself. Viruses do that. But I think that the language that we're hearing in the media is variant, strain, mutation. And I think for all intents and purposes, it's roughly the same thing.
So it is normal that it's changed. I guess you can't say soon. We've been dealing with coronavirus since, gosh, the beginning of this year.
Well, yeah, I think coronaviruses have been around for a century.
True, but this particular, like COVID-19, we've already had mutations of this. So this is not the first mutation or variant or strain. And that's what I wanted to put into context, right? So there have been mutations already, which again is not unexpected.
So why the focus on this one?
Seems strong.
Well, this one seems to be sort of coming as a predominant strain in Europe. It seems to be traveling relatively fast. There are a lot of sort of features about this one that raised alarms and bells with scientists and researchers who are tracking this.
Let me see if I can put it this way. Is this even accurate? I'm going to pretend like I'm the virus, okay?
Okay.
I get pissed off that you humans have figured me out.
Yeah.
In fact, you've made a vaccine. You're recovering from it. Not quite as many people are dying. I'm going to change myself to make myself even stronger and nastier.
Yeah. You're not wrong. I think that's actually excellent. You know, one of the reasons why some viruses mutate is to continue surviving, right? And so they change themselves to be able to sometimes to evade the things that we have in place. That is one of the reasons why sometimes viruses do that. So yes, that certainly probably is in play, and they do change themselves. So, but again, we don't know what this change fully means, and that's what we're trying to figure out.
Is the vaccine going to be any good against it?
Well, researchers right now are saying that they don't foresee any problems with it, right? They're saying, well, we don't see any reason why the vaccine wouldn't work. But look, one thing we learned during COVID-19 is that things can change on a dime. So one thing I'm telling all of my followers and my patients to do is to be flexible, because honestly, we could be saying something different in 2 days, and we've got to be flexible. The other thing is we have to stick to the things that we do know, which is, by the way, if you were thinking about traveling before for the holidays, which, by the way, people should not have been doing that, this is even more of a reason. Do not travel. There are too many unknowns, and sticking with the hand washing, the mask wearing, and all that other good stuff. That's what we should be sticking with right now.
Yeah, if there's one thing 2020 has taught us, you can't assume anything. You just have to buckle up and let's see what we learn in the coming days.
Real quickly, everybody that has had it now, should you get the vaccine?
People who've had COVID already, you mean?
Yeah.
Yeah, you should. You want to talk to your doctor about when you can get it based on when you recover from COVID. Remember, we think you can get COVID again. Like we have reported second cases. So plan to get the vaccine.
Okay.
Okay.
Thank you, Doc.
Thank you.
Okay, good to see you.